Okay, Mr. Wayne, if you're ready, we can go ahead and begin with your examination today.
Yes, I'm ready.
Okay, perfect. So to get started, my name is Dr. Perez. It's very nice to meet you. I know it's your first time in our clinic, so I appreciate you coming on as a new patient.
Thank you.
Okay. Do you have a preference as far as how I refer to you? Do you like James, Mr. Wayne?
James is fine.
James is fine. Okay. Now I will be taking a couple of notes as we talk on my keyboard, just getting everything settled into your charts since you are a new patient and we have limited information, okay?
Okay.
Okay. All right, so I do want to go over a couple of things with you before we start with the preliminary assessment, which will consist of me asking you just a few questions to get kind of a baseline of your overall health today, as well as any past medical history that you're comfortable sharing with me, okay?
Sure.
Okay. So I did read that there was a note taken by the nurse that you are slightly apprehensive about your visit today and that you seem to have some sort of what we would refer to as white coat syndrome or anxiety visiting the doctor.
Yeah.
Okay.
I don't want to go that much into it because I do have anxiety when it comes to seeing the doctor.
Okay. Okay. So that's something that I will keep in mind. Of course, if anything today makes you uncomfortable, if there's anything you're not comfortable sharing or comfortable doing, you are more than welcome to let me know and we'll kind of work around that.
Okay.
I'll be doing my best to explain things to you in depth before we get started. I'll explain my instruments to you, and I do have a demonstration that I will be giving you before we begin any of the physical assessment portion, okay?
All right, thank you.
Okay, perfect. All right, well, let's go ahead and get started. Do you mind telling me how you feel today as a whole? So do you feel physically well? Do you feel unwell?
Yes, I feel very well, actually.
Well.
Yes.
Okay. Okay, so can you just share with me your date of birth, please, month and year?
Sure, February 1993.
Perfect. Thank you very much.
Sure.
Just to confirm a couple pieces of demographic information, I have that you live on Collingswood Avenue.
Yep.
And does your current phone number end in 7890?
7890, yep.
Okay. Email address is jwayne@gmail.com.
Yes.
Perfect. And all of these pieces of information are just for me to update your chart. That way, whenever I have test results or information to input, you can access all of that and I make sure that I'm sending it over to the correct person.
Okay, thank you.
Okay. All right, James, so let's go ahead and get started with your preliminary assessment. Now, this is just going to consist of a couple questions that I'm going to ask you.
Okay.
If you'd like to decline, just say decline and I will indicate that in your chart, okay?
Okay.
So you said you're feeling well overall. Are you experiencing any pain today?
I don't think so.
No pain, okay. Any recent headaches, recent being in the last 4 weeks?
No.
Okay. Have you had any surgeries in the last couple of years? I know you haven't been to the doctor for a checkup, nothing emergent.
No, nothing at all.
Any visits to the ER?
No.
Okay. Are you currently taking any medication, prescription or otherwise?
No, I'm not.
Do you have any relevant medical diagnoses such as diabetes, high blood pressure, high cholesterol?
No, nothing that I'm aware of.
Have you ever been diagnosed with any mental health conditions such as anxiety, depression?
No, nothing.
Are you comfortable sharing whether or not you are feeling any of those symptoms currently?
Certainly, I'm comfortable sharing.
Okay, perfect. So are you currently experiencing any onset anxiety?
No, I'm not.
Depression?
No, I'm not.
Do you feel like you're under an undue amount of stress?
No, I'm a little bit,
A little
antsy
uneasy?
for being here, but I don't think it's major.
Okay. If you had to rate that stress on a scale of 1 to 10, so 1 being mild, maybe butterflies in your stomach, 10 being verging on a panic attack or anxiety attack, where would you say you are?
3.5.
About a 3. Okay. So you are experiencing just a little bit of anxiety.
Yeah, just a little bit.
Okay. Thank you for sharing. So the next 2 questions are going to be slightly invasive. It's just precautionary. I do have to ask every patient, okay?
Okay.
Are you experiencing any symptoms of suicidal ideation?
No, I'm not.
Homicidal ideation?
No, I'm not.
Very good. Okay. Now, moving on to just a brief kind of overview of your day-to-day life. Do you feel that you eat particularly well, meaning vegetables, fruits, getting in whole grains, that kind of thing?
Yes, I do.
Do you get any physical activity in on a daily basis?
Most days, not every day.
Can you tell me a little bit about what that consists of, as far as going to the gym, going for a walk?
Just walking.
Walking?
Occasionally going to the store, Costco, bringing in lots of large items, things like that.
Perfect. Okay, so the next few questions are going to be asking you whether or not you're experiencing a list of various symptoms. So you can just indicate yes or no.
Okay.
So we're going to go head to toe. So any issues with your hair, scalp, hair falling out, hair loss, scalp issues such as dermatitis, any flaking, anything like that?
No.
No. Okay. Any issues with your ears or your hearing? Any hearing loss, ringing of the ears?
No.
No. Any issues with your eyes? Loss of vision, blurry vision, floaters in your vision, issues with driving? I see that you wear glasses.
Yeah, no, not really. I do have floaters every now and then. My optometrist does know about it, but it's not severe or anything like that. Sometimes driving at night, bright headlights can be a little overly bright for me, but nothing major.
So you mentioned headlights specifically. Do you know if your optometrist has diagnosed you with an astigmatism?
I believe he has, yeah, I believe so.
Okay. Any other issues with your eyes, such as eye pain, over tearing of the eyes, or excess dryness?
Sometimes dry and sometimes also over tearing, yes.
Okay, so kind of a fluctuation.
Yeah.
Do you find that anything makes either one of those symptoms worse?
Too much time reading or on the computer or my phone can make it worse. Just make sure I take breaks here and there if I'm working or watching too much television.
Okay. Okay. Moving on to your nose. Any issues with your nose? Like experience of seasonal allergies where you're overly congested or runny nose?
No, I do have seasonal allergies, but nothing has been like bothering me for the last few years at all.
And moving on to your mouth and your oral care. Do you brush your teeth regularly, twice a day?
Yes.
Do you floss?
Yes, I do.
Do you use mouthwash?
Yes, I do.
Do you know the last time that you visited a dentist?
About a year now.
Okay, so relatively on time there. And your optometrist is also a yearly visit, I assume?
Yes.
Okay. Very good. So moving on to your neck, any issues with mobility in your neck, pain, any cracking, anything that you feel could be misaligned there?
No, nothing like that.
Anything in your upper body, arms, shoulders, chest?
Shoulders every now and then, just a little shoulder pain. Nothing.
Shoulder pain?
Nothing major.
Is that bilateral, meaning both sides?
Yes, it is.
Okay. Any issues in your abdominal region, such as indigestion, any suspicion of like IBS or anything like that?
No, nothing like that.
No trouble digesting your food?
No.
Do you have regular bowel movements?
Yep.
Perfect. Okay, moving down, a little bit of an invasive question. Any issues with your private area? Are you urinating on a regular basis? Nothing concerning there?
Nothing concerning. No issues that I'm aware of.
Okay. Now it has been a while since your last visit. It's been over 10 years. So we will be doing pretty in-depth examination today.
Okay.
You are too young for a rectal exam, so that's good news. So
Right.
we're not quite there yet, so no
Okay.
concerns there. We won't be looking at that today.
Okay.
So moving on to your lower extremities. Any issues with your upper thigh portion, your knees, lower legs, any pain,
No.
discomfort?
No.
Any issues with your feet?
No, I have flat feet.
Flat feet?
I don't have any arches, so sometimes I get pain there, and also have bunions as well. So depending on the shoes I wear, I may have some discomfort for a few days.
Okay.
But I've been kind of living with it my whole life, so.
Have you ever seen a podiatrist?
No, I haven't.
Okay. So I will be doing a brief assessment of that today. Is there, I guess once we go over it, I can kind of see if there's anything concerning. Would you be open to a referral to a podiatrist, a specialist?
That's all right. That's fine.
Okay. Okay. And then lastly, any issues with your back? So back pain, back spasms, abnormal curvature of the spine?
No spasms or anything like that, just general getting older, back and shoulders, lower back every now and then, but nothing major, nothing crippling.
Okay, perfect. Okay, and then just a couple questions here about your home life. Again, slightly invasive. So are you comfortable in your current living situation?
Yes, I am.
Any cause for concern as far as domestic violence, physical abuse, mental abuse, sexual abuse in the home?
No, none of that.
Do you live alone?
Yes, I do.
Do you live in a house, an apartment?
An apartment.
Do you have any pets?
Yes, I have a cat.
I have 2 cats. I know some of these questions seem semi-unrelated, but it's just all part of your chart and your medical history.
It's okay.
Okay. So we already got your height and weight, and that is it for the preliminary portion of your examination.
Okay.
So I'm just going to set this down.
Okay.
And if it's all right with you, I would like to start by getting a set of your vital signs.
Sure.
So that's going to consist of me checking your temperature, as well as getting your blood pressure, and then I will be checking your oxygen saturation, which essentially is just how much oxygen is in your blood.
Okay.
Okay?
Yes.
So I am going to get a pair of gloves on, and then we can get started, okay?
All right.
All right, James, so we're going to go ahead and get started with taking your vital signs. So
Okay.
I'm just going to set this here,
Okay.
and I'm going to start by taking your blood pressure, okay?
Sure.
So this is a blood pressure cuff. I'm sure you've seen it before. It's going to go around your lower forearm. So if I can have you extend your left arm for me. Thank you. Go ahead and relax your arm onto your lap for me. Perfect. Okay. So I'm just going to get my stethoscope out.
Okay.
Now I'll be placing this on your wrist so that I can hear your heartbeat, okay?
Sure.
Okay, so just relax your arm for me. Perfect. I'm gonna have you uncross your legs. It's gonna squeeze a little tight, okay?
Okay.
Okay. Slightly elevated, it's about 138/92.
Okay.
I guess that's probably because you're a little nervous.
Okay.
Just gonna set this to the side.
Okay.
Okay, so let's go ahead and move on with the rest of your vital signs. So I'm going to take your temperature, and while I do that, I'm just going to put this on your finger. It's going to measure your oxygen saturation. So if I can have you stick your index finger out for me. Perfect. Go ahead and relax. This is just a digital thermometer. It doesn't have to touch your forehead, okay? Turn that sound off for you. It's a little loud. Average temperature about 97.9, which is well within normal limits. Oxygen saturation is at 98%, which is also fine, okay? So definitely no concerns with your vital signs aside from your blood pressure being slightly elevated. Like I said, I'd guess it's probably just that you're a little nervous, so that's okay. All right, James, so we can go ahead and move on to the rest of our examination.
Okay.
I'm just going to take a quick note of your vital signs, and then I want to give you just a little demonstration before we get started, okay?
All right, thank you.
Okay, so temperature is 97.9. To saturation is 98%. 38, 92, and heart rate 79. Respirations are about 17. All right, James, let's go ahead and move on. So just want to give you a little demonstration of what it's going to look like when we move into the physical portion of the examination shortly, okay? So I'm going to be performing a couple different things, and I have a little piece of skin here, what we like to call our skin. So this is just for demonstrative purposes. That way I can show you what we're going to be doing.
Okay.
So if and when I say I'm going to perform manual palpations, what I mean is I'll be using, for example, let's say this is your arm. I'll be using my fingers to kind of palpate around in a circular motion, possibly linear, side to side, just feeling around for different things such as nodules, abnormal lumps, bumps, that kind of thing. So some light to more firm pressure shouldn't cause you any discomfort there, okay? I know some people are a little concerned about the word palpation. It's not something not vernacular we use in regular conversation, so I just want to make sure that you're okay with that. So before we do that, I'm going to do a little bit of a head assessment. So just going to have a look at your face, make sure everything looks okay on a medical basis there, okay?
Yep.
Okay. So I have a Penlight here, and you can keep your glasses on for now. The light is fairly bright, so I'd encourage you to not look directly at it just yet, okay? So there is a point on the wall across from us if you need something to pay attention to there. Okay?
Got it.
So I'm just going to shine this over your face, and at this point I'm just looking at the overall symmetry of your facial structure. So looking to see that everything is fairly symmetrical from one side to the other. Testing for symmetry essentially just means I'm looking to see if both sides of your face are relatively the same. Of course, not everybody's face is exactly the same, but mostly looking to rule out any stroke or Bell's palsy, that kind of thing that could have any excess facial drooping, which I'm not seeing so far. So look at the side of your face here, as well as the overall posture. Okay, so all of that looks well. Okay, James, so we're going to move on to the physical examination. And I'd like to start by performing some of the palpations that we were discussing earlier on your face. So if it's okay with you, I would like you to remove your glasses so that I have better access to the ocular region then.
Sure.
Perfect, okay. So I'm going to come a little bit closer to you. Is it okay if I go ahead and touch your face?
It's fine.
Okay. So I'm just going to start on this side feeling around the orbital region for any possible signs of inflammation. So you did say that sometimes you experience some excess tearing,
Yes.
fluctuating with dryness as well. So just feeling to see if there's anything abnormal here. Is there any pain or tenderness in this area?
No, there's not. The left side of my nose is a little bit stuffy today,
Okay.
but there's no pain.
So if I put a little bit of pressure here, do you feel like it worsens?
No, it's the same.
Stays the same. Feel any pressure in this area?
Slight pressure,
On the left side only or both sides?
both sides.
Okay. So I'm going to feel directly over the eyelid. Please keep your eyes closed.
Okay.
Any tenderness here?
No, it's fine.
Okay. I put just slight pressure on your tear ducts. Is that painful at all?
No, it's not.
Okay. Can I have you open your eyes and look up for me? Okay, you can relax. Just gonna feel the lower half of your face. Do you ever have any pain or tenderness in your jaw?
No.
No. Okay. No clicking or popping sounds as you're eating or yawning?
No.
Okay, if you open your mouth for me. Very good. Keep them closed. Okay. Just gonna feel along your gum line here.
Okay.
Can I have you try to move your jaw side to side? Very good. Okay. Just gonna feel your pulses while I'm here. Okay. And along your ears, do you have any pain or discomfort here?
No, nothing.
Ever experience any abnormal earwax or excess earwax?
No, not at all.
Ears are a little bit cold. Are you feeling cold?
No, I'm okay.
Okay, so all of that looks good. I'm just gonna have a brief look at your hairline, okay?
Okay.
Very nice hairline, nice and thick. Not noticing any signs of baldness. Definitely are a little young for that, but I do just like to check for early onset alopecia. Not seeing that here, so that's good. Thank you. Look at the beard as well. Do you keep a beard regularly?
Yes, I do.
Well, that looks okay. So I'm just going to have a brief look at the external portion of your ear. And taking a look at the back. Looking for any signs of abnormal discoloration. As well as looking for any signs of debris or any signs of excess cerumen or earwax, which I'm not noting here. Do you use Q-tips to clean your ears?
Yes, I do.
Okay. Externally, or do you insert them internally?
A bit of both. I don't go too far. Just
Okay,
to
just
the,
a little bit.
Yeah, the edge of the cotton. That's all.
Just gonna have a quick peek at this side.
Okay.
Again, looking at the back of the ear. And then just gently pulling here. And all of that looks great. Okay, very good. Okay. Doing okay so far?
Yes, I'm okay.
Okay, perfect. All right. So we can go ahead and move on, and I'd say we can get started with a little bit of an ENT exam.
Okay.
It's just going to comprise of me testing your ears, nose, and throat.
Okay.
So I'm going to start with your ears, if that's okay with you. Very, very brief hearing exam. You can obviously hear me at a regular conversational basis.
Yes.
So I just want to test that you're able to kind of differentiate between louder or quieter sounds or more sudden sounds.
Okay.
Obviously won't be making anything too loud as I don't want to damage your eardrums.
Thank you.
Do just want to test that you're able to hear things at different frequencies. Okay.
Okay.
Okay. Are you comfortable closing your eyes during this examination? If not, I can block your vision with a card.
Yes, I'm okay. Closing my eyes.
Okay, perfect. So I'll have you do that now, and I'm going to make a variety of sounds.
Okay.
I'm going to start with just using my hands. Okay?
Yes.
So I'd like you to tell me first if you can hear this on both sides.
Yes, I can.
Perfect. Now if you're able to just differentiate between what side you hear it on, so just left or right, okay?
Okay. Left side. Right side. Both sides. Right side. Left side.
Good. Okay. So I'm going to move on to a different sound here. And this is going to be our very quiet sound, okay? So
Okay.
slightly difficult to hear. This is a pair of tweezers. Can you hear this?
Yes.
So testing your directional hearing. I'm going to move the object around your head in various regions. I'd like you to just indicate where exactly you hear it.
Okay.
So an appropriate response would be something like left, right, above, below, in front, or in back.
Okay. Left. Left. Right. Right. Front.
Very good.
Left. Left. Above.
Very good.
Left.
Okay. Now can you tell me where the sound starts and where it ends? So do you hear this here?
Yes. It started on the right and then went to the left.
Perfect. Do you hear that okay?
Yes, think from the left and then to the middle.
Very good. One more time.
From the back to the left.
Very good. Okay. Okay, let's see. For our last sound, I'm going to be using a tuning fork.
Okay.
So this is just going to produce different sounds essentially. So for example, can you hear that?
Yes.
Okay. So same thing for this one. I want you to just start by telling me left or right, okay?
Okay. Right side. Left side. Left side. Right side.
Okay. Can you tell me if you can hear this evenly on both sides?
Yes.
Where do you hear it?
Left.
Where do you hear it?
Right.
Now I'd like you to tell me when the sound stops. So you're going to hear the sound on a particular side and then you should hear it abruptly stop.
Okay.
So just let me know when you hear it stop, okay?
Okay. It stopped.
Good.
It stopped.
Good.
It stopped.
Good. So testing bone conduction, I'd like you to tell me if you feel a vibration.
Yes. Yes.
Okay. Now one last thing, I'd like you to tell me whether or not position 1 or position 2 is louder, okay? So to give you an example, this is position 1 and this is 2.
Okay.
So just say which is louder, 1 or 2.
Okay. 2 is louder.
Good.
2 is louder.
Very good. Okay. And no issues at all with your hearing, James? Your ears are perfectly well intact, okay?
Okay.
Alrighty, so let's move on to an examination of your nose. I'm going to test your nasal patency.
Okay.
So I'm going to occlude or close off various sides. I'd like you to tell me whether or not you can breathe in and out of that side. So I'll have you inhale, exhale.
Okay.
Let me know if you feel any difficulty there, okay?
Sure.
So I want you to start by just taking a normal deep breath in through your nose and out through your mouth. Good. Now I'm going to occlude the right side.
Okay.
Go ahead and breathe in. Good. And the left side. Did that feel different on either side?
No, it didn't.
It felt okay.
Yes.
So even with the stuffiness, you're doing okay on the
Mhm.
left. Okay. So I have a couple things here that I'd like you to smell.
All right.
So this is a test of your olfactory nerve. So your olfactory nerve controls your sense of smell and whether or not you're able to differentiate between smells.
Okay.
So I have a couple things that are very, excuse the ambulance, my office is very near the ER, I apologize. I have a couple smells that are very, what I would say average things that you would come into contact with on at least a weekly basis, okay?
Okay.
You can just indicate to me what you smell.
Okay.
Don't let the color of the bottles deceive you. It is meant to be deceptive in a way to where the color does not indicate what's inside, essentially, okay?
Okay.
Alrighty, so if I can have you close your eyes for me. Okay. Smell anything there?
Lemon or lime?
Very good, that was the lemon. Smell anything there?
I think cinnamon.
Very good, that was cinnamon. Okay, last one.
Lavender.
Lavender, very good. Okay, so no issue with your olfactory nerve. To moving on to have a quick look inside your mouth. Is it okay if I look inside?
It's okay.
Okay. So if I can start by just having you smile for me. No teeth? And with teeth? Just the top? Can you do just the bottom? Good, and both. Big smile. Very good. Okay, beautiful teeth.
Thank you.
I'm gonna have you open and say ah. So having a look at the hard palate. You don't have to keep saying oh, it's okay. Hard palate looks good. Can I have you lift your tongue up to the roof of your mouth? Having a look at the soft palate here. Very good. Okay. And then if I can have you open, stick your mouth out. So, I'm sorry, stick your tongue out very far. Back of the mouth looks good. Tongue looks good. Okay. All right, now I have a couple things that I'd like to test orally. One of them is your bite strength. So I have what's called a bite block here. This is just a styrofoam block. It's very firm yet soft, so it will allow you to leave a dental impression.
Okay.
I'm gonna have you bite this in various directions.
Okay.
So just bite down on it. You're gonna feel a slight tug. It shouldn't hurt your teeth at all, okay?
All right.
Bite down. Any pain there?
No.
Good. Other side. Any pain there?
Uh-uh.
Right in the middle. Any pain there? Okay, so we're gonna do a very big bite here. Bite down. Good. One more. Very good. No pain or discomfort there. Feel like any of your teeth are loose?
No.
Okay. So I'm just gonna have a look at the impression here. Okay. So this just allows me to see if there's anything that appears misaligned or if you need a referral to an oral specialist here, but all of that looks okay. Typically I would test your gag reflex. Is that okay?
Okay.
Okay. You seem a little apprehensive. If you're uncomfortable, we don't have to test it
No,
today.
I'd rather not.
Okay, that's fine.
Okay.
That's okay. So just gonna take a couple notes here. Your oral health appears well intact. have very straight teeth. Have you ever had braces?
No, I haven't.
Just naturally straight. Very good. So that concludes, for the most part, the ENT portion of our examination, okay? Why don't we go ahead and move on to an eye exam, if that's okay with you.
Okay.
Okay, so I'm gonna have my Penlight here. And the first thing I'm gonna test is your pupillary reflex.
Okay.
So let me just grab a card here.
Should I have my glasses on or off?
For this portion of the eye exam, you can leave them off if that's okay with you.
Yes.
Okay. So I have a card here that I will be using to occlude your vision.
Okay.
To start, I'm just going to shine the light in both eyes.
Okay.
I would like you to keep your eyes focused on the point across the room if that's okay.
Okay.
So just coming a little bit closer.
Okay.
Slowly introducing the light. Very good. Very good. So now I'm going to occlude one side.
Okay.
So I'm just going to cover one eye.
Okay.
I'm going to do that on the other side. Perfect, okay. Give you just a second. I know that's a little bright.
Yeah, it's very bright.
I do have one more lighted test if that's okay with you.
Okay.
Okay, so this is called an ophthalmoscope. It's going to allow me to have a look at the back of your eye. So essentially looking at your ocular anatomy, your retina, your cornea will allow me to look at all of those things that kind of hide behind the eye, okay?
Okay.
You do have to get very, very close to your face.
Okay.
Okay. So I'm just going to rest my arm here.
Okay.
If I can have you look up for me. Good. You can look towards me and then away from me. Lastly, I'm going to hold your eyelid if you can look down. Perfect, okay. Same thing on the other side.
Okay.
Good, go ahead and look to the left and to the right. And look up. And look down. Very good, okay. No issues with the internal eye. Everything looks great. All right, James, if it's all right with you, I would like to test your visual acuity. So this is called a Snellen chart. I'm sure you've seen it in a variety of sizes. So there's one that's 20 feet distance that's fairly large. We have one over there, and typically I would have you view that from across the room. So this is a pocket chart. I'm going to hold it at about arm's length, and I'd like you to just indicate whether or not you can read the letters. I will point to them for you, okay?
Okay.
We're going to test first with your glasses off, if that's okay.
Sure.
So holding it about here, can you read this?
ELTFPHOLCF. No.
Too small?
Can't read that one.
Here?
CFDHJ.
Very good. Okay. Can you tell me what color this is?
That's red.
And this here?
Green.
Perfect. Now we have a visual occluder.
Okay.
Similar to the white card, this time there's a hole on one side and it's
Okay.
open on the other. So are you comfortable holding this up?
Yes.
Okay, so you choose which eye you'd like to occlude to begin with.
Okay.
Can you read this line here?
DHJBS.
Good. Can you read the bottom line?
No, I can't.
This line?
No, I can't.
This line?
Not really.
This is the smallest line?
Yeah, DHJBS
Okay.
is the...
Can you switch eyes for me?
Sure.
Can you read this line?
DHJBS.
Can you read anything lower than that?
I think EFTEG.
Okay. A couple of those were incorrect, but you are able to see a little more with this side.
Yes, just a little bit.
Okay. So I'm going to have you place your glasses on, and then we'll repeat a couple of the tests. So with both eyes, can you tell me the lowest line that you can read, whichever?
Yes, LTFPH.
Very good. And I'll have you occlude one side.
Sure.
Lowest line?
LTFPH.
Good. Can you switch eyes for me?
Yes. LTFPH.
Very good. Okay, perfect. So with your glasses, you're 20/20 in both
Yeah.
eyes. Without your glasses, your right eye is about 20/40.
Okay.
Left eye, about 20/40. You were able to see a couple at 20/30, but obviously your glasses are working, so that's
Yes.
very good news. Okay. All right, so just a couple more things for your ocular examination here.
Okay.
So I have this little book. Now these are called Ishihara test plates. Have you ever been tested for color deficiency?
I don't think I
Color
have.
blindness?
No, I don't think so.
Okay. So these are kind of circular plates with different colors on them. This is just a tester, so you should be able to see a number here.
Okay. Yes, the number 12.
Very good. Do you see a number here?
Number 8 and number
Mhm.
5.
Good. A little
29.
harder. Good.
74.
Very good.
7 and 45.
Very good. So it does get harder as we go on.
Okay. 2.
Do you see a number here?
No, there's no number, just like a pattern.
Very good.
16 and another pattern.
Okay. Can you trace that pattern for me?
Sure.
Perfect. Good job. And lastly, do you see a number here
35.
and here?
96.
Good. Okay, so you're definitely not colorblind. That's great news. Okay, so final test for your eyes. You can keep your glasses on.
Okay.
So I'm going to close the occluder.
Okay.
There are very small holes here.
Right.
I'd like you to tell me if you can still see me through those holes.
Okay. Yes, I can.
Can you see my hand here?
Yes, I can.
Can you tell me how many fingers I'm holding up?
2. 3. I can't see the outside. 2. 1. Can't see it,
Okay.
unfortunately.
Can you switch eyes for me?
Sure. Okay, 2. 1. I can't see that one. 1. 3.
Very good. Okay. Take this from you. So I'm going to test your peripheral vision just briefly because you did miss a couple of those, okay?
Mhm.
So what this is going to consist of is I'm going to move something in and out of your visual field. I'd like you to indicate to me when you see it and
Okay.
when you no longer see it.
Okay.
I'm going to use this rectal thermometer. It is clean.
Okay.
Simply because it's red, so it's a good indication of your visual field here, okay?
All right.
So can you see that color there?
Yes, I can.
Okay. So I would like you to keep your head straight for me. So don't turn your head in any way. Just keep your head midline, okay?
Okay.
Focus your eyes on the middle point there.
Okay.
So you should not be able to see this here.
That's correct. I cannot see
I'm going to
it.
move it into your visual field and you'll tell me when it appears.
Okay.
Okay?
It appeared.
Is it gone now?
Yes.
Okay. So then just let me know when it disappears.
Okay. Okay, I see it. I still see it. disappears, reappears, disappears, reappears, disappears, reappears, disappears, reappears, disappears, reappears, disappears, reappears.
Good. Okay. So no issues with that. All right, James, we are moving right along. Are you still doing okay?
Yes, I am.
Do you need to take a break?
No, I'm okay.
Okay. So just gonna update the notes as far as your visual acuity.
Okay.
And your test for color deficiency. So all of that was well within normal limits. Okay. Okay, so let's go ahead and move on. Why don't we go ahead and take a couple of measurements here?
Okay.
Because you're a first-time patient, I would like to measure the circumference of your head, the distance of your eyes, and then the length of your upper extremities. So just measurements for us to keep on hand, and then of course if you decide to come back for an annual visit, we can reassess and make sure that there's no swelling or edema happening, okay?
Okay.
So I'm gonna measure the circumference of your head, so just relax for me.
Okay.
Okay, we are right at 25 3/4. So now I'm just going to measure the distance of your eyes in proximity to your ears as well as to each other. So I'm going to start here. 7. Okay. 6. Perfect. Okay. If I can have you extend your left arm for me, so straight out in front of you. So I'm gonna measure shoulder to 24. So 12. About 9. Perfect. I'm gonna come around. If I can have you extend your right arm. Perfect. 24. Slightly longer. Okay. So your right forearm, you can relax. Your right forearm is about 3/4 inch longer than your left, and that is totally normal.
Okay.
So as I was saying earlier, no one is perfectly symmetrical. So it's
Right.
fairly unrealistic to expect that your extremities on both sides will be exactly the same length.
Okay.
Okay. Okay. All right, James, so that is great. So let's go ahead and move on. And I believe I would like to test a couple different things here. So one of the things is I have a couple objects I would like to place in your hand. So this is a bit of a neurological assessment.
Sure.
So what's going to happen is I'm going to ask you to close your eyes. I'm going to place an unknown object in your hand. Very common object, so nothing to worry about. I'm not going to place anything scary or anything inappropriate, just a day-to-day object. I'd like you to try to identify what it is just with tactile stimulation. So if I put a penny in your hand, you're likely able to tell that it's a coin at the very least.
Okay.
So if I can have you close your eyes for me. Okay, so you're welcome to feel around.
Okay. It's a cone.
Very good.
Clothespin.
Can you tell me what it's made out of?
Wood.
Very good.
I'm not sure. It's like plastic with a little metal piece. Oh, it's like a, yeah, I'm not sure what it's called, but there's like a little feather on the end.
Okay, very good. All right, and then lastly,
sponge.
very good. Can you identify the shape of the object by chance?
Square.
Good. Okay, so you did really well there. So kind of in line with that test, I would like to draw or write a couple figures, letters and numbers in various hands.
Okay.
I would like you to let me know if you can identify what that is, okay? So
Okay.
just to give you an example, if I use this object here, if you'll extend your hand for me. So letters will be facing you.
Okay.
So with eyes open, for example, this would be the capital letter A.
Okay.
Okay?
Yeah.
So if you can close your eyes for me and attempt
Okay.
to identify, we're going to start with letters.
Okay.
Did you catch that?
I don't think I did. Can you try one more time?
Of course.
Letter B.
Very good.
One more time, please. I'm not sure.
Okay.
L.
Okay.
W.
Very good. So let's try this hand. This time it's going to be numbers, okay?
Okay. 6. 3. One more time, please. 5.
Very good. Okay, so all of that was well within normal limits. That test can be a little bit difficult. You did
Yes.
really well. Okay, so let's go ahead and move on. Since I am still kind of in the upper region here, if I can just do a quick test of your reflexes.
Sure.
So I have a couple different hammers. I know that sounds a little scary. So a medical hammer. This is one of them.
Okay.
So essentially just going to use this to test your jaw reflex.
All
So
right.
I'll have you kind of loosely hang your jaw open and then very gently tap. It won't cause you any discomfort. It's just to test kind of the strength and reflex of your jaw there, okay?
Okay.
So I'll have you just very loosely kind of hang your jaw. Good. Good. And then if I can have you open wide but still kind of very lazily. Good. Good. Okay. Similar concept, this time with a different hammer.
Okay.
This is more malleable, kind of soft rubber. I'm going to be using this to test the reflexes in your arms. Okay? So just to give you an example.
Okay. All
Okay.
right.
So just keep your arm relaxed for me.
Mhm.
Good. I'll do that one more time here. Perfect. Now if I can have you hold your hand like this and keep your fingers flaccid for me, okay? Good. Okay. So coming to the other side, just relax your arm for me. So just relax your muscle there. Perfect. Good. And we're going to hold your hand up. Very good. Now if I can have you hold your hands out, I'm going to stimulate your hand with the bottom of my hammer.
Okay.
I'd like you to just look forward for me and kind of ignore what I'm doing, okay? You can keep your eyes open. Good. Okay. Lastly, for your upper extremity reflexes, I would like to perform just a test of your balance.
Okay.
Modified, I don't want you to have to stand and walk around the room. So if I can have you just hold your hands up for me, I'm going to just kind of tip your hands.
Okay.
I'm going to do it with your eyes closed first, if that's okay. Okay, can you flip your hands over for me? Straight out in front of you. you can open your eyes, keep your arms out in front of you. Good. Okay, you can relax. Just testing your ability to remain upright.
Okay.
Okay. All right, James. So I am going to just test some strength in your upper extremities here. I'm actually going to start with your head.
Okay.
So I'm going to have you manipulate your head in a certain way that allows me to test the muscles.
Okay.
So I'm going to place my hand here.
Right.
Can you turn your head into my hand?
Sure.
And don't allow me to push it back.
Okay.
Perfect. Same thing on this side. And if you can push down and back, don't allow me to push you forward. Good. Okay. If you could place your hands like this for me. I'm going to pull towards me. Don't allow me to do that, okay? Okay, and then push. Don't allow me to push towards you. Good. Now with just your wrist, same thing. So perfect, and back. If you could extend your fingers, don't allow me to close them. And then if you could close really tight and don't allow me to open. And then quickly with your eyes, if you can squeeze your eyes really, really tight and don't allow me to open. Okay. Are you able to puff out your cheeks? And don't allow me to deflate. Good. And then lastly, if you can open your mouth, don't allow me to close. Very good. Okay. So strength in your upper body is very well intact. Okay. If it's all right with you, I'd like to test your lower extremities just very briefly.
Okay.
So I'm going to test the reflex in your knee.
Okay.
So I'm just going to... Good. Okay. Lastly, for this part, it can be a little bit uncomfortable. I'd like to test your Babinski reflex, which is part of your neurological response.
Okay.
So what that consists of is I'm going to use the bottom of this tool, similar how I did on your hands.
Okay.
I'm going to glide it along the bottom of your foot.
Okay.
A lot of people are ticklish there, so I do apologize. It is an important response test, though, okay? So just very brief sliding across the bottom of your foot.
Okay.
Good. Very good. Okay, no, it is very ticklish. Thank you very much. You did really well.
Thank you.
Okay. All right, James, we are breezing through your examination. I would like to do just a very, very brief test of your sensory response, sensory perception, okay? Essentially, I'm just going to use a couple different objects to test whether or not you can feel it.
Okay.
Also, whether or not you can differentiate between different textures or different tactile sensation.
Okay.
Should only take a minute or two, okay?
Okay.
So I'm going to start with the same thing on both sides. So this is the sponge that I had you feel earlier.
Right.
So I'm going to ask you to close your eyes. I'm going to touch your face and your arms simultaneously like this. I'd like you to just indicate whether or not you feel it on both sides equally or whether one side feels different than the other.
Okay.
Okay?
I feel it. I feel it. I feel it the same. I feel it. I feel it the same. Same. I feel it the same. Same.
Good. Okay. No differences there at all?
No differences.
All right, so now I'm going to repeat the test, slightly different this time. I'm going to be using two different sensations.
Okay.
So this is that feather object that you felt you were unsure of earlier. So very soft sensation here.
Okay.
This is actually an acupressure tool, but I like to use it because it is spring-loaded.
Okay.
So just a cold metal object, you should feel the difference between this and this.
Right.
Okay. So for the purposes of this examination, I'd like you to just state whether or not you feel sharp or dull.
Okay.
Okay.
Dull. 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 Sharp. 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 Dull. sharp, dull, sharp, dull, 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 sharp, dull, sharp, sharp, dull, sharp, sharp, dull, sharp, sharp, both.
Very good. Okay. That does conclude the sensory portion of the examination. You did really well.
Okay.
We are almost done. The last thing I would like to do is feel along your lymph nodes.
Okay.
So you have chains of lymph nodes that run along your temples, as well as kind of behind your ears and down your neck,
Right.
as well as along your clavicle,
Okay.
and then under your arms as well. So the reason we feel for this is just to ensure that there are no kind of edematous nodules, which just means like swollen bumps underneath the surface of the skin that I maybe cannot see.
Right.
These things can indicate like a risk for infection, okay?
Okay.
So I'm just going to be feeling around. I will ask you to maybe swallow at one point so that I can feel along your trachea, okay?
Okay.
Okay. So just relax for me, James. I'm going to come just a little closer to you here.
Sure.
So I'm going to hold my hand behind your neck here just to kind of stabilize a little bit. And I'm going to start by feeling kind of underneath your jaw. You can let me know if any of this feels uncomfortable, if you feel any pain in any of these areas. It is important that you indicate that, okay?
Okay.
So feeling along the clavicle here, the collarbone, as well as the shoulders. Can you swallow for me? I'm just going to expose your chest here just a little bit, okay? Okay. I'm just going to feel briefly in your axillary area, so if I can have you just lift your arm for me. Okay, perfect. You can relax. All of that felt okay.
Okay.
So, excuse me, the last portion of your examination, I would like to come behind you, if that's okay.
That's okay.
Just gonna feel your back, so feeling for your lungs. I'm gonna have you say a couple things that will help me assess your lungs as well,
Okay.
as well as some flexibility, mobility in your neck. I'll have you turn your head, okay?
Okay.
Very brief scalp exam while I'm back there. I might just peek around at your hair.
Okay.
Okay, so I'm gonna take my light with me, and I'll hop around the table. All right, James. So I'm just gonna be back here for just a minute doing a bit of an assessment.
Okay.
I'm gonna start by having a look at your scalp, okay?
Okay.
Any areas of tenderness here?
No.
No. Just starting by having a look at the base of your neck, so the nape of your neck, having a look at your hair texture, as well as the color of your scalp, noting any signs of abnormality or discoloration, which so far I'm not seeing. Hair color, texture, scalp color and texture is normal for age and ethnicity, which is a very good sign. I'm not seeing any, so I'm not noticing anything that I would consider abnormal here, which is very good. Just having a look at the back of your neck as well. Can I have you keep your shoulders where they are and then extend your head as far back as you can? Good. And then as far forward as you can. Perfect. Okay. All right. All of that looks good. So just going to perform a couple palpations of your shoulders and your back, okay?
Okay.
Okay, so I'm just going to feel around very briefly here. Feeling for any signs of abnormality. All of that feels normal. So if I palpate along your spine, is there any pain or discomfort there?
No, there isn't.
Good. Okay, so I'm going to do a very brief lung assessment here, okay? So
Okay.
taking out my stethoscope. And I'd like you to just breathe normally for me. Good, okay. So no issues or abnormalities suspected there. I'm going to place my hands on your back. I'd like you to say 99 when you feel me touch you, okay?
Okay. 99, 99, 99, 99, 99, 99,
Okay.
99, 99, 99,
One more time.
99.
Good job. Okay, so I'm going to come back around the front, okay?
Okay.
All right, James. So as far as I can tell with your examination today, everything was well within normal limits, okay? So there were
Okay.
no cause of concerns. Having a look at your feet, I did briefly assess the areas that you said were of concern to you.
Yes.
I do think it would benefit you to see a podiatrist, so essentially a specialist that is affiliated with the hospital,
Okay.
someone that can better kind of guide you as to what the best remedy would be.
Okay.
So I know you said you do have a little bit of discomfort in the toe there,
I do.
so I do think that Dr. Feinstein would be great for that.
Okay.
Highly recommended colleague. I have absolutely nothing but good things to say about him, okay?
Okay.
So I can go ahead and get you referred over to him. There's nothing you need to do. I'll put it in the system and then he can schedule you electronically. Dr. Feinstein is pretty technologically savvy. He does like to reach out to first-time patients via patient portal.
Okay.
So I would highly recommend that you gain access to your patient portal.
Okay.
Persephone up at the front desk can help you get that set up, okay?
Okay.
So before you leave today, if you'd like to just head to the receptionist desk, I'll put a quick note into Persephone. That way she's expecting you. She can get you set up with your patient portal. And then any updates about your examination today or your referral to Dr. Feinstein, all of that will be accessible within your portal.
Okay.
Okay?
Yes.
All right, James, so I just wanted to say I really appreciated you coming to see me today. I know it's been a while since your last examination, and I'm glad that you felt safe enough to come to the office.
Yeah.
I'd love to schedule you for your next annual exam. You are also welcome to do that in your patient portal whenever you're ready. I don't see a need to see you again within the next 12 months
Okay.
unless you are, interested and you'd like to come in for whatever reason, that's fine.
Okay.
But other than that, I hope we were able to kind of relieve a little bit of your medical anxiety today, okay?
Yeah. Thank you so much for taking your time and then just showing me the things before you did it. That does help a lot.
Of course, absolutely. I know sometimes clinicians can kind of struggle with becoming desensitized to things. We do it so many
Yeah.
times a day that it just seems normal that you know what this or that object is, and that's not always realistic. So
Right.
I do like to give, especially first-time patients, a little bit of extra time. So I'm glad that you had a good visit today.
Thank you so much.
Okay. I hope you and Baby Cat get home safely, and
Thank you.
Persephone should be expecting you up at the front desk.
Okay. Thank you.
Thank you very much.
Mhm.